Hello, everyone. Thank you for joining us today. Appreciate your time. Uh, I'm Mike Furman. I'm the CEO of Omega Systems. Omega Systems is a managed services, IT managed services, and managed security services provider headquartered in Eastern Pennsylvania. Really focused on two main industry verticals: financial services and healthcare. And uh, we were delighted late last year in the late October timeframe to welcome Peak Technology Partners, a managed services provider based in Maryland and entirely focused on the healthcare vertical, to join forces with Omega. And I'm delighted today to have Chris Knotts with me. Chris Knotts is the founder and CEO of Peak Technology Partners. And today's topic primarily is to talk about operational friction, specifically operational friction in a healthcare practice, and how that looks, how that feels when it's tied to IT in particular. And most importantly, talk about some things, some practical things that we and you can all do to reduce that friction. And then we'll have some Q&A if time allows at the end, which should be great. Chris, maybe I'll just kind of kick things off.
Sure.
I hear you talk a lot about walking into a practice and feeling it, seeing it firsthand, what operational friction looks like. Maybe you can talk a little bit about that experience you've had so many times in the past when you enter into a
Yeah.
practice.
Yeah. I mean, sometimes it's been in my role as a healthcare IT company leader, and at other times it's just been as a patient. And that's happened more than once. Usually, we're working with practices. Obviously, they have an electronic medical record system. They've got other medical devices. They're using a call center or some type of phone system, and you know they probably have guest wireless so that people can get on to the network if they're sitting in the waiting room. The 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 friction that I've observed usually is evident right at the front desk. If the staff is they're feeling like they can't work in their systems, or they can't get the tools that they're working with to work at the speed of their click, which is usually pretty fast. You see it, you feel it, and it happens really before you even talk to one of the physician owners, or if you're on the patient side, you're seen by the clinical staff. So technology is in everything that our practice customers are doing today. So if any piece of that system really doesn't operate at the speed that they need to operate, then it slows them down, and that creates frustration. That creates inefficiencies in the practice. So usually it's evident right at the front desk if systems aren't working at the speed that they want it to. It's my kind of joke when I walk in, either as a patient or if I'm there in another capacity. If someone's saying, "Oh, my system's not working fast enough," or the system's not booting, I'm like, "You've got to be nice to your computer," which always gets a little chuckle. But that's how they feel sometimes. Like, what do I have to do to my systems today to get them to work at the speed that I need to operate?
Yep.
So you just feel it that way. You try to make light of it, but it impacts them.
I've seen it as well as a patient. Walk in, you'll see them referencing a scribble pad of sorts, where they've jotted down notes, shortcuts, maybe even passwords on stickies, things that they're trying to do, little life hacks, if you will, that they're trying to do to work around some of the friction and obstacles that they have in there. Um, so what happens? If I'm working, let's just keep the front desk analogy going. Let's say I'm at the front desk. At some point, what do I do when I'm stuck with these little things that are, kind of gnawing at my daily functions and my productivity? Do I what does that look like over time, when you have this day in and day out?
Yeah. Uh, the first thing is something you mentioned earlier, which are workarounds. People find ways to work around the system, uh, and then those practices sometimes become embedded in just how people get things done. There may be a way to actually perform a function within their EMR, like insurance verification. Uh, but if that doesn't, again, work at the speed that they're looking for, then they find enough. Maybe they don't do that. They skip that step, which could cause a problem downstream when it comes to billing. So I think workarounds are one. Um, Complaints, they raise their hand until they're tired of doing it to the practice administrator. And then that kind of at a low level becomes part of their frustration in their job that they do. Uh, and that impacts customer service because maybe they actually have to take extra steps to get something done because technology isn't working properly. Or in some cases, I've seen it where they just can't work. They've got to go to paper. I've been in situations where there's a server outage or their EMR is down, and it completely impacts
Huh.
their environment. So, I think the systemic things lead to workarounds. They lead to built-in inefficiencies. They generally also lead, again, at that staff level, to frustration with their jobs.
Yeah.
And that,
And I
that leads through. That can affect patient care. It can affect the patient experience.
absolutely makes perfect sense. And I would guess at some point, not when you have complete work stoppage, but when there's just a series of little things popping up every day, you sort of just end up accepting it for what it is. Like it's just kind of the way it is. Do you see that happening? Are practice owners sort of just like, you know what? It's not everything I want, but it's sort of the way it is and not worth my
Yeah,
time, effort. So just an
I do
accept.
see that.
Yeah.
I think that comes up in a couple of ways. If you kind of now we're moving into just the day to day IT support. Again, technology isn't everything that the practice is involved in. Every system is on some type of computer based system of some sort. So there's an acceptance of status quo. If it's not completely broke, we're not going to address it. If they don't have a full outage, then they're not going to take the steps to maybe migrate that server out of that closet that's at the end of the hallway and into the cloud. So it's a little bit of an acceptance of mediocre.
Yep.
In some cases, there's different opinions within practice leadership of let's not change things, or I've got to wait until a particular doctor leaves before we can usher change, and that impacts things too. you know the day-to-day operational efficiency is kind of the low level stress that's created, but what ultimately can happen in situations where IT isn't performing properly is that there can be some type of outage or security event that really does impact things. And then there's usually a willingness to make a change, but if it's just the everyday low level, it typically doesn't drive change. It just impacts the practice in ways that are really tough for them
Yep.
to to quantify on their own.
Makes sense. I know you've told me a number of times before there's a relatively straightforward way to walk into a practice, sit down with an owner and understand in their own words what that environment, looks like. When you walk in and you ask them to tell you about their IT environment, like what are some of the telltale signs, things you hear from them that tell you that there's a series of these, annoyances underneath the surface?
Yeah. Um, well, and that's evolving a bit because now more practice owners are starting to think about AI, and we'll touch on that some. Uh, you know, there's an acceptance of status quo and of less than ideal. Um, if there's usually change transitioning IT providers, at least in the practice mind, is a daunting task. We usually really work hard to make that very smooth. So the fear of change in some cases can cause a good enough solution is better than ideal, or is as good as ideal, which is unfortunate because in some cases technology can be used in ways that really do improve the practice. Um, so and there's also a real lack of understanding of the potential vulnerabilities that could exist again, in their security. But I do also see some of this changing with the many AI tools that are out there. And a lot of times, recently we're hearing, how do I use this tool or that tool, or what should we be doing? What should we allow our staff to do? So that conversation's changing a bit. I think a lot of it was focused on security and compliance, which still needs to be a major focus, especially with the HIPAA changes that are likely coming this year. But as this AI topic also comes into the mix, there's a lot of questions. I think that's brought technology back to the surface because there are these new and fundamentally model shifting tools available to practices now. So it's creating a lot of new questions.
Yeah. And do you find that when there's operational friction in the practice, that it either tamps down the interest and desire to do a lot of these things you've just been talking about? Like, is it getting in the way of being able to advance the business forward using these new technologies, ensuring effective compliance, et cetera?
Yeah, in many ways, especially if the practice is focused on growth. And I see this regularly where they want to grow. It's challenging to be in the private practice business,
Right.
and reimbursements are pinched and margins are pinched, and one of the ways to navigate that is to grow. Maybe introduce new services, new capabilities. We see practices that didn't have surgery centers before opening surgery centers or adding new services. And if IT is a drag in the business, then it's going to limit the ability to do things like that, to add new services. I think one of the compliments that I've heard and heard more recently was a practice owner grew his practice 20 plus locations, and then he exited the business. But in that process, one of the statements he made was having smooth running technology and really using technology as a tool for the business helped them accelerate their growth, and it was never a barrier for them growing. So it does impact it. It's a drag on the organization. There might be questions about, well, how do we actually do this, or can we implement this, or could what challenges will we have with technology if we decide to go down this path of expanding the business? So you don't want that to be the case. Technology shouldn't be a limiter. It should be an accelerator for a practice if they're choosing to expand their business or change the business in any way.
Right. Makes a lot of sense. Then I was curious, because you spend so much time talking to practice owners, what if you had to pinpoint one, maybe two things that are the most common items that a practice owner underestimates with respect to day-to-day operational drag associated with their IT environment? What would those be?
Yeah. Well, one is definitely the cybersecurity risk. That is regularly underestimated. At this point, many practices, if they haven't been through a cyber event of some sort, they know somebody who has.
Uh-huh.
But I still talk to practice leaders and physician owners that make the assumption because they haven't had an incident, they are therefore secure. Um, and it's just the wrong assumption to make. There are so many ways that cyber threats are evolving, that the practice and the IT team supporting the practice needs to evolve as well. So that's significantly underestimated. In some situations, the threat of a cyber incident, because having an OCR event or having to take the practice offline for a few days, and those letters that go out to patients, those are very reputationally harming. And I think we've become numb to it a bit, but it's definitely a real threat for practices. So that's underestimated. Just the way that IT and the technology they choose and the EMR they choose can enhance the practice. I think that's underestimated. It's very difficult to change electronic medical record systems, but we're seeing the change of of EMRs and practice management systems really at a pace that I've never observed. Of course, there was the original wave of everyone moving to EMRs, and then there's been a slow transition as some have kind of become more feature full, and others have reduced in features or even gone out of business or been acquired. But we're seeing that more now, where practices have enough experience to know, we know what we need. We see systems in our specialty that are very effective, but that's an area that can be underestimated, which is, how staying on a current platform is potentially holding back the practice.
Right.
So we see many practices thinking about what that next step might be, and considering a change.
Yeah. And then there's on the surface, looks like small issues where it takes an employee 3-4 extra minutes to do a job than it has to because of drag around IT. But I think we often kind of accept that as normal, but then you think about a practice that might have 20, 30 employees, and you multiply those 4 minutes across
Yeah.
5 or 30 people on a daily basis. And all of a sudden you're adding up to what could be at a minimum a part-time salary that you are ended up paying to cover the cost, if you will, of that. You see that happening in practice?
Yeah, I do. And, the statement, "This is the way we've always done it,"
Uh-huh.
I hear regularly. And that's something, if you hear that, dig in a little bit deeper. Ask the why, the 5 whys that get you to really an answer. Um, that's a huge issue. Uh, using and we all get into habits of how we use our systems and our tools around us. I mean, I know that I do it. Taking at least annually a set aside time to step through the processes within the organization is a very healthy thing to do, because it uncovers those 3 or 4 minutes that people are doing, things that add up. And just asking some questions about, how do you show me how you go from A to B with this task that you're trying to perform, if it's a
Yep.
billing task or if it's front desk task. That can be done usually with somebody in the practice that's focused on process or compliance or continuous improvement. Some cases you can use an outside vendor or a consultant to help think through practices. In many cases, the EMR vendors will have some continuing education, because their features change. The
Right.
way to get a task done in last year's version, maybe you still can do it that way, but there could be a new feature that simplifies that task. So I usually recommend someone within the practice being the process person. Sometimes that's the practice administrator, sometimes that's someone else. As organizations scale, there can be someone whose job that is full time, to always be thinking about the processes and the steps people take. It's obviously technology comes into the play, but a lot of times it's the software that they're using and how they're using it and how they could potentially use it more efficiently. One of the things that I've seen done is a patient like journey map. So if you're thinking about it from the patient's experience, from the moment they search for you as a service provider, and that's changing with AI. At one point in the last year, the number of searches that were happening within Google, dipped below the searches that were happening within ChatGPT or AI tools. And the way that those work, many people don't really understand, but it's
Uh-huh.
very different than how search engine optimization works. So from the moment that a patient searches for you all the way through to billing and continual relationship, taking a look at that patient journey and mapping that out and thinking about what that patient experience is, because now customer service surveys and those responses matter. They can impact reimbursement as a factor. So thinking about it from the patient's experience, thinking about it from an employee's experience too, and having someone in your practice that at least annually put some dedicated time into really looking at processes and trying to make improvements.
Yeah, I think the employee aspect is often overlooked because if the patient journey isn't great, that often ends up being felt, the weight of that being felt by the staff.
Yeah.
And because nobody's getting up to come to work every day and doing a poor job taking care of outcomes for their patients. And so they care about that stuff and they feel bad when that outcome isn't the best it can be. And ultimately, I would guess that can lead to burnout on staff. They're just coming in every day and feeling like you're not doing everything the best, the fastest, the for the best patient outcome starts to wear an employee down over time. And then you have the whole additional costs with respect to employee morale and retention and replacement of people, and it just becomes a bit of a, a spiraling mess at times.
Yeah. Um, I literally have been part of conversations where a doc has, said and has left because of continual EMR issues. That's just not what they signed up for. They're either working in a system that's antiquated or something that is, again, to the earlier comment, can't work at the pace that they want to work.
Uh-huh.
And it's become an unfortunate norm for that workday to extend well beyond the clinic hours into the evening if they're wrapping up notes or doing summaries or continuing their tasks. One practice that I met at a conference recently had an initiative for 2026, which was no after hours work in the EMR. And people want to get their job done, so they're going to put the time into it. But their initiative was to get rid of that. And it was ambitious because there's still only a certain number of hours in the day. But the
Right.
technology has to work at the pace of the provider, at the pace of care, and that's fast. And the any system issue, if it's the software or the infrastructure, can impact that. And again, we've seen staff leave, we've seen providers leave, and if they don't take it that far, it at least can impact their outlook on things.
Makes sense. Okay, great. I think, Chris, I think we've done a really good job sort of laying out the reality of the situation today around uh, operational friction in the environment and what it looks like, how it's felt by the staff. Let's talk a little bit. Let's transition over into the cost of that to the business. I'd love it if you could walk us through what it's like. What does it actually cost to practice? Not necessarily on the technical side of things, but like give us at least a view in broad terms of how that shows up in terms of what it costs the business when you have this friction going on.
Yeah, I think different practices are run different ways. Um, the best run practices understand their throughput. They understand the metrics within the business that ultimately lead to a billing event, because they got to pay the bills, they got to pay the docs, they got to keep the doors open. So there's in the best practices, there's some clarity around that. They know what procedures, how many they have to perform, how um, you know booked or flexible the schedule needs to be, and the impact of technology in that whole conversation is a continual thread. And to the extent that the EMR is slowing them down or adding extra steps is slowing them down is going to impact that throughput, that number. And maybe the baseline is a certain number of procedures or visits a day, but if they were to reduce the steps by two or three, they could add one more, and that could be a 10% impact on the profitability or revenue, and taking the analytical steps of understanding how they have add-on services, what codes they're using as they're meeting with patients. And there are some tools now that are coming within the electronic medical record systems, and some of those are AI based, that can help with that can prompt for other questions that are leading to a more comprehensive care, which may actually lead to a higher billing rate ultimately. So the tech not just the efficiencies, but how it's used in the practice can have an impact on the profitability, on the revenue side, on the cost side, and it's really going to be dependent on that specialty and the types of procedures that they perform. In a pediatric practice is going to be different than an orthopedic practice, but you can think of it in terms of throughput, and throughput is impacted by poorly performing IT, by processes that are inefficient, and it's very reasonable to say that you're going to get another 10% out of this system if all the pieces are working right or more. So whatever that metric is in your world for the practice, if you add 10% to that, or take 10% away if you're having an issue, or stop it altogether if you have a cyber event or some type of server outage, it really does come down to dollars and cents for the practice. That makes a difference, and it can impact positively or negatively depending on how things are
Yeah.
running.
And I have to assume cost could be growth. So this could be costing you the ability to grow that next location that you have been talking about wanting to expand to, or that new procedure that you want to roll out. That stuff potentially gets stuck kind of because the business can't move at a scale necessary to do these new things. I would have to assume that's also you
Yeah,
feel like a true cost from a dollar and cents to the daily operations, but it's costing you growth, isn't it?
it is, and that's sometimes it's just not quantified. I was in a practice that had multiple locations, and the because of the systems, it was completely a systems limitation. It was a limitation of how their phone system worked. It was a limitation of how their EMR was set up. Uh, as the providers moved from locations, and there was reasons why they wanted to see patients in one part of the state one day and another part of the state another day, they had to bring their care team with them to each of the locations. The same person that was doing triage and phone service, this is 2026. We've got technology that allows us to route calls properly, and we can work in systems. In this case, they couldn't. They didn't have that flexibility. So that entire team needed to move with the doctor as they moved. And it was part of that. This is how we've done it. It was
Uh-huh.
also partly they were they just had accepted that these are how the systems were, and it was in some cases the site was convenient for the doc, but not convenient for the staff. So that creates all types of things. So you, if they wanted to grow and add other locations, they've got to have this whole other staffing discussion just because they want to add another location. And they were looking for ways to improve their bottom line and to grow. They had some new doctors in the practice and they wanted to expand further, but they had these limitations. So that's an extreme example of whole groups of staff moving. Uh, but it's the underlying issue is accepting the way things are, or not really thinking through how the technology plays, does impact growth. And the earlier story I told, where that physician founder felt like technology was an accelerator of his growth because the way that we designed the systems, really all they needed to do was find the real estate. They found the real estate. They had the operations team, they had the recruiters, they had the credential team that could bring the docs in and get everybody set up. And we had our marching orders. Once we got to a dust-free date, when the site was ready, we came in with the tech. We already had the circuits provisioned, and it was never a limiter of their growth. It was in fact an accelerator because they knew they could just add on sites
Yeah.
as they needed to. It
That's
impacts them.
ultimately how we know we're doing our job right, when it
Yeah,
becomes an accelerator for folks. That's
exactly.
great. But oftentimes there's work to be done to get to that point where it becomes an accelerator. I know you spend a lot of time in a consultative approach with practices and practice owners and leaders inside the practice. What's probably like the most striking thing that what once you consult with them and you show them and they see maybe for the first time the breadth and the depth of of what the friction that exists is costing the business. Like, give us an example of something striking that you've heard a practice owner say to you when they sort of that light bulb goes off.
Yeah. Um, Probably the most impactful has been, the ability, just statements around their ability to help and keep the business profitable. It's you don't usually think about IT and keeping the doors open and keeping the lights on, but when you have the flexibility to add a new location or add a new service or open a new, you um, surgery center, that can be transformational for the business. And I've seen that happen, more than once, where you know, opening their eyes to how they can grow their business. Because private medical practices are unique. The physicians are the owners; they're
Uh-huh.
the entrepreneurs. They're also the product, so they've got to be there to deliver the product. So it's they usually don't get all the time they want to focus on the business, and that's the part that suffers, their health, but also the health of the business. So the most striking and then gratifying things that I hear are about how we help them grow, sustain, protect their business, which is not something they always get to focus on. So that side of it is important. And we also support practices that are part of groups or that are part of an organization that are scaling, by bringing in new locations, and that's just as important. So
Uh,
when they're acquiring practices, how you bring those sites in, how you onboard them, and we're involved in a lot of that. One of the experiences recently was a practice was acquired. They were really fearful about the whole process. It's scary. The physician owners kind of understand what's going on. They're selling or they're migrating or they're joining a larger group, and they have their own anxieties. But the staff, that's 10x. What's going to change? How is my job going to be affected? What's this new IT team going to be like in these new IT tools? We got in the form of an email a note from a practice owner who had sold to a larger group, who had a lot of anxiety about for him and his staff about how that was going to go. And it was glowing about how smooth that process went from literally on a Friday, seeing their last patient under their current systems, and then we got to work, replacing computers, changing equipment, bringing new phones in, cutting things over. Lots of planning went ahead of that to make that go smoothly. Monday morning came. We're there for day one support, helping them. Their staff was happy. The patients didn't even notice the blip. And then the continued support after that was engaged and thoughtful.
mhm.
And that made them feel better about that whole process. So the aspects of care, we don't always understand the care side in their specialty, but I certainly can understand, the business and the tech side, and the things that we do to help them really makes a difference.
Yeah. You mentioned a few times just recently about staff and the pressure on staff. We talked about earlier about how important retention is and the cost to replace staff who get burned out and tired of operational, drag or friction. I'm sorry. Um, h- how directly does that friction we talked about connect to physician burnout? So we talk about staff who are bearing the brunt, whether at the front desk or back office or what have you, but are you seeing this translate into the physician, the owners themselves as well? Is that a problem?
Yeah. Yeah, I think the extended work days
Mm.
is a really good, unfortunate example, that is systemic. So they're never really off. There's always something to do. I hear and experience anxiety in some of the physician owners that we work with, and that anxiety can be around cyber risks. I see that too. Uh, if they don't understand that they're secure, then that fear and doubt can really impact. Or if they've experienced an incident before, or they know somebody that has, so anxiety is certainly something. They're worried about their practice, their people, their ability to continue operating as a business. So I think the extended hours, the actual workload, and how that impacts their life balance, and the anxiety that comes generally, mostly around cyber, which is something that we really work to help the practice understand how they're being secured, the steps that we take, the tools that we use. Education and the conversation really helps. But yes, absolutely impacts the physicians and the physician owners too.
And let's keep on the talking about the physician or practice owner. Um, One of the things sometimes most concerning that we hear is, I don't really think I've got any issues with my IT because I don't have any. Over the last 6 months, it's been real quiet. I'm not seeing anything pop up, and I know for us in the industry that puts some immediate red lights on. Talk a little bit about how a practice owner actually knows whether their IT environment is performing or underperforming.
Yeah. Yeah. Good question. There's a couple of ways. One is when there are problems, how quickly are they resolved? First of all, the best issue is no issue at all. So, if you're in an environment where you're continually having trouble tickets and system problems, that's a red flag. It doesn't need to be that way. If there's a, if our philosophy is, if we see a ticket that comes in once, okay, maybe that was, we want to understand that. If it comes in twice, all right, there's something going on here, and we need to kind of dig in deeper. Is it an education issue? Is it a systems problem? Is it software? Let's solve that. So recurring issues that are either, even if they're resolved, if they're recurring issues, that's a flag. One of the things that we do at Peak is during our IT business reviews, we look at with the practice a summary of where the problems are within the practice. And we do work ahead of that to understand, were there any trends? What can we do? In many cases, it's just a user education thing. So we're proactive about that. So you should be getting that from your IT team, some type of dashboard or visibility into the problems that are happening in the practice, because if you're doing your job right, you're many layers removed from the day-to-day trouble tickets and the issues that are happening, because that's within your organization. But you still need a way of seeing that in a distilled way to know, do we have problems that are systemic? So, lack of proactivity around solving issues, or maybe lack of visibility. So that like you said, it could be that they just don't know what they don't know because they're not being given the visibility by their IT team. Um, then, from time to time, there are outages. When there is an outage, how quickly were we able to recover? In the new HIPAA requirements, there's a 72-hour recovery window. That seems like a long time, and it is. I mean, that's days. But what happens to your practice if you were down for 3 days? If you weren't able to see patients for 3 days, how impactful is that? So that's the new standard, a 3-day recovery. And we've seen practices down for a week or more, or actually in some cases they were never able to recover certain amounts of data. Maybe it was a PACS system that had an imaging system that had a drive that failed that wasn't properly backed up, or those backups weren't tested. So you should be hearing from your IT team or having the conversation about disaster recovery. And disaster is a big word, but that could be something as small as, what if our internet circuit goes down? What do we do then? Do we have a secondary internet? Can we go to cellular? Do we have some other system? So there should be clear communication between the practice and the IT team around recovering from events. Modern server technology, if it's in the cloud, that recovery should be near instantaneous or even undetectable. If it's on a server, it can also be engineered so that there's no downtime. And there's always a cost from zero downtime to there's a how much can we spend to get to zero downtime. That's always a conversation. But even if it's server based, there should be redundant drives. There should be on-premise backup. So Those things need to be tested. Uh, the worst backup is one that hasn't been tested because you don't know if it's actually going to work when you need it. These should be high level conversations at least with your IT team, and they should be able to show you evidence that we've tested the backup restoration, that we've tested internet circuit failover, that we've tested these things. You don't need to get into the details, but you do at least need to have visibility into what that team is doing around recovery. And again, with the new HIPAA requirements, that's going to be something that's called out specifically.
All of this can sound really daunting to somebody who's a physician and not an IT or technical, mind. You guys have built a relatively straightforward scorecard approach where you can walk into a customer and pinpoint where that friction occurs, kind of isolate it into specific actions. I mean, tell us a little bit about that, because I I know I'm just listening to you and I'm thinking, if I'm a physician right now, yeah, I've got some problems. It's costing me a little bit of time and patience and a little bit of stress, but I don't want to go through like this huge overhaul, soup to nuts of my environment. Like, there's a path forward to do something more straightforward, more streamlined, and more efficient, correct?
Yeah, yeah, we call that our technology alignment approach. And it happens when a new practice onboards with us, but then it also happens continually with the practices that have been with us for years. And today it's about 180 points that have come from HIPAA guidance, again, which is expanding our own best practices, things that we've observed in the best run practices, how they operate IT. So it's essentially, at a very simple level, it's a checklist. It's a way for us to go in during onboarding, and the practice is functional today, unless things are hard down. They're operating, so things are working at one level, but maybe not optimally. What we do initially is, within that first 90 days, is to perform this technology alignment assessment. And it does result in a gap analysis. So here's best practice, here's HIPAA requirements, here's where the practice is. And we can highlight those. And it's easy to kind of translate that into a letter grade that we all understand. So maybe it's a C or a D today. We're going to understand why it's a C or a D, and then be able to explain to the practice, here are the gaps. And we're going to prioritize the ones that matter most first, around security, usually around the things that are the highest user impact. But what we typically do is then come out of that assessment with a 3 or 4 or longer quarter plan to bring the practice into alignment. And then we continue that process at least once a year, but in most cases twice a year with the practice. And that's everything from, it's the stuff you would expect, our servers up to date, is our networking equipment configured properly, but it's also things like, is there a lock on our IT closet? Is there proper passwords on our guest internet? Do we have guest internet? People expect that in today's world, to be able to get Wi-Fi when they come into a business. So we step through that. We create a plan. We can help the practice prioritize spending, timing. There's always a story. There's always initiatives. They've got, this quarter is not good because we're trying to do XYZ, or open up a new location. So we can plan with the practice a multi-stage process to get them into alignment, and then to keep them there. So that's our technology alignment approach, and it's been very effective. And it feels good when the practice is run and they're an A, and they understand why. And then the proof is in the stability of the environment. The proof is in the security of the environment, not having security incidents, really feeling like things are frictionless. And that's a great place to be.
Agreed. Great. Chris, thank you. We'll try to give you a chance to catch your breath. I know you've been on the hot seat here for about 45 minutes. We've got a big audience out there. There's a Q&A tab on the chat. I know with the size of audience that we have, there's bound to be some questions out there. We'd love to spend 5-10 minutes entertaining any Q&A, things that either came to the chat with and haven't gotten answered yet, or things we've talked about that may have piqued interest or concern. We'd love to entertain that, please. All maybe while people are thinking and typing, Chris, I know a topic that comes up, we do these discussions a lot. A lot of people already have an IT provider that's doing work for them and may have been doing work for a really long time. How do how does somebody on the call today know whether that IT services provider is doing the right job for them?
Yeah.
How do they keep tabs on them, if you will?
Hmm. Yeah. Good question. I had that question this morning. Now, a potential a potential client said, "Well, can you help me evaluate my IT team?" And what I offered was, I can give you some questions to ask, and their ability to answer these questions, that speed at which they answer the questions, will tell you something. Um, and for us, all we do is support medical practices, and one of the primary friction points and specialty areas is security. So, asking questions around the HIPAA compliance, again, particularly with the new rules coming, um, that have many new requirements that are, if things go through as they are, by the third, fourth quarter of this year will be requirements.
Right.
How that IT team is responding to that, what systems and solutions, because there will be new tools required that weren't needed before under the new rules. So there's some questions around security and HIPAA compliance, and the new security rules are one. Hearing it from the staff, they probably know it already, but if they don't, ask the staff, what are your interactions with XYZ IT team? Are they responsive to you? Do they get the answers that you need? Are they do they seem to understand our workflows and our processes? Because we only support medical practices, we've gotten to know almost all of the major electronic medical record systems. So the peak team can provide a tier one or tier 1.5 level of support for Athena or ECW or Veradigm, or so. That's not always something you find in every IT team.
Uh-huh.
You have to go to another vendor to get that part. So, asking questions of your staff, asking questions around IT security and the coming HIPAA rules changes are good ways to start.
That's great. Thank you. Right. Let's see. Question that just came in. How do I know what kind of AI tools are right for us?
Yeah. Great question, and that's a conversation I'm having a lot these days. Uh, the We're paying a lot of attention to this space, and there are at this point probably thousands, if there's certainly hundreds of AI tools available for medical practices. It's noisy. Um, we've built a tool called AI Lab, that is on our resources page, but it's also peakailab.com, where you can pick your specialty, pick your electronic medical record system, pick kind of the problem you're trying to solve, and we've looked out at the marketplace to identify AI tools that are available. In some cases, we've tested them, reviewed them. So that's one way. Um, the electronic medical record providers themselves are, most of them are doing quite a bit inside of their platform, and the best place to start
Uh-huh.
is what is happening inside of your EMR and your practice management system. Um, that's There's going to be probably 80% of what you're trying to do can and should happen within your EMR. But then there are all the ancillary processes and tools and things that you're trying to solve. So, staying plugged into your medical society. Just did a webinar and then had a conference spot, speaking on finding and selecting AI tools. So, staying involved in your associations, your state medical board. If you're a practice administrator, MGMA, the Medical Group Management Association, there's a lot of good content coming out of those groups. Some of it's vendor oriented, so you kind of have to put your filter on, is this a sales pitch, is it not? Using tools like Peak AI Lab is another way. We provide some of the services of helping a practice navigate picking an AI tool and implementing it if you're a client of ours. So it is fully reasonable to expect AI guidance from your IT team,
Mhm.
and they should be providing that to you and contextual to the applications that you're using. I think I'm seeing a divide beginning to happen of the IT teams that can do that and the ones that can't do that, and it's an important part of technology guidance in today's world is to help people find the right AI tools to use. And we see some leaders, it's the leaders today, and the next 6 months how things are going to change. So um, it's an evolving space. It deserves a continual conversation with your IT team or someone that's skilled at helping you find the right tools.
I agree with you on the expectation from an IT provider that that's sort of table stakes to be able to come in, be the people and the and the third party that understands the most about that. Even as a technology company in Omega, it's a bit daunting some days just to keep up with all of the different language models, all the different evolution of updates and even just the big ones,
Yeah.
and put yourself in a physician's shoe who's not getting up every day focused on that technology as their primary, mission like we are. And it's really important to have a partner that somebody you can trust to come in and really advise on what to use, how to use it, how to create the right data governance structure around it, and to ensure that whatever investment you're making in is actually yielding appropriate, results on the other side.
Yeah,
So,
there are a lot of shiny things out there right now, so
right,
it does take some diligence and patience.
absolutely. Okay, I don't see any other questions, Chris. I think for the group, we've got a quick poll question we'd like to put in front of everybody. If we can get that queued up, here it is. How confident are you that your current IT environment is not costing your practice money right now? Be honest. We'd love to understand this some more. And as people put in their responses here from the audience, Chris, we'll give them a few minutes here to get that done. Maybe not a few minutes. How about one? How confident are you that your current IT environment is not costing your practice money right now?
Yeah, I think this question, it's a reframing of how is IT and technology working for you. It's I don't think practice owners or practice administrators really think about the financial impact of poorly performing technology or underperforming technology. I think that the whole AI discussion is really a good example of that. You know, there likely are tools available that can improve your practice efficiency.
Yeah,
If you're not being guided to those tools, then that's impacting your bottom line
that's
one way
right.
or another. And I
That's right.
think if I'm seeing the kind of the results, not confident appears to be the overwhelming leader, which is it's beyond unsure. That's really a statement to say that you think that IT is costing your practice. Um, that it's certainly not helping your bottom line. It's hurting your bottom line.
Yeah, perhaps not terribly surprising that that's the predominant answer.
Yeah.
Um, but hopefully for those who spent some time today joining us, that you found the conversation, some of the anecdotes and ideas helpful for you. We know that for those of you who are uh, owners or leaders in a practice, your time is extremely valuable, and so we are very appreciative of you spending 60 minutes of your busy day with us. Um, we we're going to follow up afterwards with a version of the scorecard we were referencing to give everybody an idea of what that framework looks like that Chris was describing, that we can help walk you through. You can do that even yourself. But just to give everybody on the call an opportunity to think about how best to move forward in assessing or reassessing the environment to make sure you're getting everything that you can and should and expect out of the IT resources, tools, and people that you've got around your business. Chris, any closing remarks you'd like to make?
Yeah, this has been great. Thanks, Mike, for the questions and the dialogue. I know this topic, I mean, just from the participation today, is important to a lot of people, and look forward to any follow ups and having deeper conversations about technology, how it can be used to improve the practice, how they navigate AI. So yeah, but just love to continue the conversation. Thank
Wonderful.
you. Yeah.
Great. Thank you, Chris. Thank you, everybody who took the time to join. Have a great rest of your day.
See you, everybody.